Simulation Restorative Procedure Number 1. Tooth number 11 buckle, Class 5 composite. The assistant will pass the explorer in the left hand and the mirror in the right hand in unison to the operator. Operator examines the area to be prepared using the mirror and explorer. Tooth number 11 buckle, Class 5. After the operator has examined the area, the mirror and the explorer are passed back to the assistant in unison. The assistant will place the mirror and explorer back in the instrument cassette. The operator and assistant ensures that the tooth surface is clean. As required, the assistant will prepare the pumice in a plastic cup or use the non-fluoridated prophy paste already prepared. This will be held in the assistant's left hand for the operator to use to clean the tooth surface with a disposable prophy cup placed in the slow speed handpiece. At the same time, the assistant will hold in the right hand the high volume suction. Once the operator has finished cleaning the tooth is then rinsed by the assistant with the air water syringe in the left hand and the high volume suction in the right hand. With the tooth surface wet and the overhead light retracted, the appropriate shade of the tooth is chosen using the shade guide. The shade guide is passed to the operator in the assistant's left hand. The shade chosen will match the shade of the composite material to be used to fill the cavity. The dental assistant will locate the corresponding shade of composite material to be used. The assistant passes the single applicator with topical anesthesia in the left hand and a 2x2 gauze in the right hand to the operator in unison. Using the gauze, the operator dries the area to be injected. The operator applies topical anesthesia using the cotton swab. The single applicator with topical and the 2x2 gauze is taken by the assistant with the right hand and placed into the biobag. The anesthesia syringe, which has been set up by the assistant, is transferred to the operator under the chin area of the client and is placed on the operator's thumb with the assistant's left hand. When the assistant's right hand is free, it can help steady the syringe if necessary and is also used to remove the loose cap on the needle. Once the cap on the needle is removed with the assistant's right hand, the assistant will now use the left hand to turn the bevel of the needle towards the bone. The operator will anesthetize the area. As the operator is anesthetizing the area, the assistant will place the needle cap in the safety shield. Holding the safety shield with the needle cap in place, the assistant will hold this in the right hand and have this ready to pass to the operator behind the client's head when the operator has finished with the injection. The operator will take the needle shield with the cap in place, and the operator will be responsible to recap the needle. The syringe can be placed on the assistant's unit after the needle has been recapped. The assistant will have the air-water syringe and high-volume suction ready in the left hand. The injection area is well rinsed by the assistant with the air-water syringe in the left hand and the high-volume suction in the right hand. The assistant will pass a cotton roll using the cotton pliers to the operator with the left hand. The saliva ejector is placed on the corner of the client's mouth. The assistant will pass the mirror to the operator depending on the tooth surface being prepared. The operator will begin the first phase of cutting through the hard enamel layer. This is done with a high-speed handpiece using a cutting burr, either a cross-cut Fisher number 557 or a number 33.5 inverted comb burr. The assistant will hold the air-water syringe in the left hand and the high-volume suction in the right hand. It is important that the assistant suction and keep the mirror clear, if used, without obstructing the operator's view. Any time that the operator stops the handpiece, it is the responsibility of the assistant to thoroughly wash and dry the cavity preparation. The operator will re-examine the area using a mirror if needed and an explorer. To save time, both the air-water syringe and the high-volume suction are held together in the assistant's right hand, and the assistant will pass the explorer to the operator with the left hand. Once the operator is finished using the explorer, the assistant will retrieve the explorer in the left hand and place the explorer back in the instrument cassette. The assistant will now hold the air-water syringe in the left hand and the high-volume suction in the right hand. A slow-speed handpiece will now be used with a medium round burr, number 4 or number 6, placed in the contra angle. It is important that the assistant keep the cavity preparation area clear of particles by using the high-volume suction and spurts of air using the air-water syringe, and that the assistant washes and dries the cavity preparation after drilling is completed. The operator uses the mirror if needed In a small spoon excavator, the assistant will place the air-water syringe and high-volume suction back into the holders. The assistant will pass a small spoon excavator to the operator in the left hand and will also have a 2x2 gauze ready to wipe the small spoon excavator in the right hand. The operator will now use a large spoon excavator to continue removing any particles of decay. The assistant will have the large spoon excavator in the left hand between the thumb and the index finger and will extend the middle and ring finger to retrieve the small spoon excavator from the operator. The small spoon excavator will be placed back into the instrument cassette. The assistant will rinse and dry the cavity preparation using the air-water syringe in the left hand and the high-volume suction in the right hand. Once this has been completed, the air-water syringe and high-volume suction are returned to the holders. The assistant will prepare and mix the appropriate amount of calcium hydroxide, also known as dical, or glass ionomer on a paper pad using the appropriate spatula. The operator places the needed amount of calcium hydroxide or glass ionomer into the cavity preparation. The assistant will hold in the right hand the paper pad between the thumb and index finger and a 2x2 gauze between the fourth and fifth fingers, and hold the dical applicator in the left hand. The assistant will transfer the dical applicator to the operator and bring the paper pad close to the field of operation. Using the left hand, now remove the 2x2 gauze from the right hand and be prepared to wipe the dical applicator if needed. Once the operator has finished applying this material, use the left hand to retrieve the dical applicator and place the dical applicator back on the tray setup. The assistant will transfer the etch 37.5% phosphoric acid with a new tip in place to the operator with the left hand. The operator will apply the etch to the enamel and dentin for 15 seconds. Once the operator has completed using the etchant material, it will be passed back to the assistant in the left hand and placed on the assistant's unit. The assistant will use the air-water syringe in the left hand and the high-volume suction in the right hand to rinse the etch off the tooth after 15 seconds, ensuring that the etch is removed. The assistant will slightly dry the tooth with puffs of air from the air-water syringe. Do not desiccate or overdry. Prepare the OptiBond Solo Plus material. To open Unidose OptiBond Solo Plus package, tear foil overwrap at cut. Remove the OptiBond Solo Plus Unidose capsule from the foil and discard foil. Grip OptiBond Solo Plus Unidose capsule at wings. Twist each side in opposite directions until seal is broken completely. Discard side with the long stem, the longer half. Dip the microapplicator brush into the opening of the remaining piece, the shorter half, wetting the microapplicator brush completely. Retract the overhead light to avoid premature setting of all bonding materials. Transfer the wet microapplicator brush to the operator with the left hand. The operator will apply the OptiBond Solo Plus to the enamel dentin surface with the microapplicator brush with the OptiBond for 15 seconds, using light brushing motion. The microapplicator brush will be transferred back to the assistant. The assistant will place the microapplicator brush back into the capsule in the event that it is needed again for this client. The assistant will use the air-water syringe in the left hand, and using the air only will blow a light stream of air to the cavity preparation to air thin the material for 3 seconds. The assistant will use the curing light with the light shield and light cure the OptiBond on the tooth for 20 seconds, ensuring that the curing light face does not come into direct contact with the tooth surface. The shade of the composite was already chosen at the beginning of the procedure using the shade guide. The assistant will have the proper shade of composite ready to be used. When using the gun style of composite, the assistant will insert the proper shade compule of composite into the composite gun. The assistant will remove the sealing cap from the composite compule and transfer the gun in the left hand to the operator. When the operator has dispensed the composite into the cavity preparation, the assistant will exchange the gun with the PFI using the left hand. Have a gauze ready in the right hand to wipe the PFI if needed. The operator will contour and shape the composite resin material in the cavity preparation with the PFI. The composite is placed in small increments until the preparation has been filled. After the composite material has been contoured and shaped, the assistant will light cure the composite material using the curing light and the light shield, ensuring that the curing light face does not come into direct contact with the tooth surface. The amount of time required to light cure the composite will depend on the depth of the composite material used. The assistant can now return the overhead light to its proper position over the working area. The operator will do an initial gross reduction using carbide finishing burrs or diamond burrs in the high-speed handpiece. The assistant will have the air-water syringe readily available in her left hand and the high-volume suction in the right hand to be used as required during the use of the high-speed handpiece. The operator will continue shaping and smoothing the surface using the coarse, medium, and fine discs on a mandrel in the contra angle of the slow speed handpiece. If required, a white Arkansas stone in the contra angle of the slow speed handpiece may also be used for final polishing of the composite restoration. The assistant will have the air-water syringe and suction available to use as needed. Final examination of the completed restoration will require the assistant to pass the operator an explorer in the left hand and a mirror in the right hand if needed. Since rubber dam was not used for this procedure, the cotton roll that was used to isolate the area would be removed. Ensure that the cotton roll is moist using water from the air-water syringe before removal to avoid any cotton roll burn. The assistant will pass the cotton pliers to remove the moistened cotton roll. The occlusion would be checked at this time, but since the cavity preparation was a buccal class 5, this class of restoration is not involved with an occluding tooth surface. The assistant performs a full mouth rinse at the completion of the appointment. The restorative dental assistant will provide to the client any post-op instructions pertaining to the dental treatment received. The entire procedure must be documented in the client's chart under Treatment Rendered. The yellow restorative treatment plan sheet is to be filled in with the client's information at the completion of the procedure and is to be completed and signed by the dentist. The white restorative summary sheet is to be filled in by the assistant. Both of the above stated yellow and white sheets, along with the client's chart and the client, are to be escorted to the dental receptionist. At this time, the client will be asked by the dental receptionist to pay for services and schedule any further appointments that may be required. The student is to fill in the information on the top portion of their restorative evaluation card. The card will then be given to the dentist to complete the student's restorative evaluation. The restorative evaluation card is to be totaled and placed in an area designated by the clinic manager.